Hi guys, this is Leyla. I don't know if you can recognize me or not. I look like a Swedish meatball. And I'm feeling really fine, even though it looks bad. And this is the fourth day after my surgery. Wait, I had it on Monday, the 2nd of April, and today's Friday. Tuesday, Wednesday, Thursday, Friday. Yeah, fourth day. I got home yesterday. I wanted actually to stay. I should have gone home on Wednesday, but I wanted to stay one more day at the hospital because they were taking really good care of me, and because my mom works there, so she could visit me more often during her work, and also because they had this cooling mask, which helped a lot. It's actually like it's some kind of mask that gets some kind of liquid, and it's attached to a machine, so you can regulate the temperature, so it cools down the swelling, and it's really nice, and it makes it easier to breathe because a lot of the cool water is coming here, so it opens up your nose a little bit more. I hope you can understand what I'm saying. If not, just ask. Okay, what else? I will tell you about my experience. I'm not a really a person that gets scared a lot or anything, so maybe I'm taking this too chill compared to other experiences. As long as you don't panic, I think you're great. It's just your set of mind, I think. The surgery went really good. Um, they said it was gonna take about 4 hours, but I think it took. What my mom said that it took 5 hours, and I like. It doesn't matter how long it takes, just that they are really precise in what they do. And I really feel like I have a really good staff around me. They're experts. They handle everything so good and so professionally. So I'm really happy. I was in the wake up room for a little bit longer time than normal. I guess I was tired or something. I had amazing four nurses around me in the wake up room. They helped me a lot, and just like, even though you cannot open your eyes sometimes, because I think my eyes were like they put something on your eyes, so I don't know. I think just to keep them down a little bit. I don't think they glued them, but anyways, doesn't matter. Just to hear when you wake up little by little, like people around you really like talking calm and knowing exactly what they're gonna do, and just like hearing that they think about you, even if they don't know that you're waking up. So they did. I could see like a little bit that every 15 minutes or so they came and just filled in a journal and how I looked and how I reacted. I also could see my mom because she's working at the hospital, so she could get into the places that normal people can't. She came around twice. She was freaking out, but moms are moms. Of course they worry. We were stupid because we put them in these situations, right? But everything went fine, and they kept me a little bit longer in the wake up room because the only down part was that I was feeling really sick to my stomach after the surgery, and it has to do with how you handle the anesthesia. Last time I had a surgery before, and I removed my tonsils. So I had almost the same reaction, a little bit like, yeah, throwing up and stuff, but that's just, normal reaction for somebody. I During the surgery, I got down a lot of blood in my stomach. I swallowed it. So that's why you feel extra nauseous also. So when I had this mask on, my mouth got a little bit dry, and that I normally don't like it, so that's why I felt nauseous. And then all of the things, yeah, the blood and everything came out, and then my nose started to drop, yeah, nosebleed. But that's normal because when they cut here and move the bone upper jaw a little bit out, like the sinuses here and everything, they move a little bit, so it's easier to bleed. But that's just old blood because they give you anesthesia through your nose. So yeah, that's normal as long as you don't move that fast or anything, or So I had it out of my system, so it was much easier to read. And yeah, I'm gonna tell you a little bit about what you can think about. As you see, I'm not hurting anything right now. It's because of the pills. I got, like I said, great care at the hospital. They're so nice. In my case, I can open my mouth really a lot, which I didn't think. I don't have rubber gums yet. That's for the next appointment in the 10th of April on Tuesday. So I can actually eat a lot. Well, everything that's processed. I didn't expect that. And for me, that I love food. All my friends know that. And my best friend that is probably watching this, she's obviously, I think she's going to be happy to hear that. So, a great tip that I got from the hospital was I had difficulties using straws because my lips, it's like a little bit difficult. You have to like suck it in and everything. Then you have to use the lips, and they don't close. But this is actually really good. Yeah, you feel like a baby again, and I actually never used this as a baby. I went directly to the spoon, but it's really good, and you can actually put it in your mouth. No worries, look. And just down and just swallow. Because the only thing, you don't have any problems with swallowing. Just, yeah. So this is like a really good thing. You can mix everything in it and put it in. I got that from the hospital. Another thing to take care of your hygiene, because I get a lot of like oily face and stuff, and that's normal after the reactions. These deep cleansing facial wipes, really good. They take care of that extra fat. Although you should probably have it because I think it will be more nice. Just like clean yourself and around the eyes, because sometimes from that liquid that you get during the surgery or whatever, sometimes it comes to your eyes and it stings a little bit. No worries. That's a really good thing. Of course, like you all guys said, Vaseline. Got that from the hospital, so I took it home. Really good to use with a Q-tip, because I don't know if you guys have. I have like a little, they put in days before, these little pins or whatever, and they're gonna hold the rubber gums. So as your lips get oh my god, I don't speak English. As your lips get bigger, they push you into these needles so you can have a little bit of pain. So you just take a little bit of Vaseline and roll it. And when the lip detaches from that, it's fine. Just put in a little bit of air or something. Yeah, Vaseline really good because you lose a lot of skin here. And that's normal. I just peeled it off. Don't feel anything. And new perfect skin will come. Another thing that I could use, but you should be really careful, is, because you have a little bit of blood left and stuff like that. But if you're taking it really careful, as I am, no problem. What else? Yeah, I used to feel a little bit more vigor yesterday. It's gone down. I don't have any troubles of breathing or sleeping. If I have pain, I just take some pills, stool pills in your bottom, and the second ones, just swallow. I can swallow the normal pills, no problem. Just take the time to follow the doctor's order. Don't do anything stupid. Don't think that you're better or anything. And if you're not feeling that you're in pain, don't take the pills. I mean, as long as you're fine, because your body doesn't need extra pills if you don't need it. That's why I think I recover really good, because I really listen and, take your time. You're not in a hurry or anything. Yeah, another thing that you can ask your staff at the hospital, which I saw from a girl that posted this on YouTube. You can ask them, because later when I'm going to get rubber bands, it will be a little bit more difficult to open this much, so you can fit in this. So I asked them if I could buy anywhere or get from them this kind of injection thingy. Looks like when you're, like from when you used to play nurse or something before. And it was really nice. They gave you that for free, the really big thing, and then like the hose that I can cut down. So if I will have any problems with the rubber gums, that I can just put it here when where they removed my wisdom teeth. But that will be in the future. For now, I don't have any problems. I've been eating today muesli. Yesterday, a lot of beans, different beans, lenses and stuff. I don't know if you call them lenses, because beans are really good to eat because they contain a lot of protein, a lot of the essential basic things that that meat can offer you also. So if you don't get meat down the processor, all kinds of beans, really good. I'm really accurate with my food. So to get more, the best way, like the best way ever, is to mix everything and just do it yourself. I mean, you feel a lot better. What else? I'll just see. Yeah, my videos are taking a long time, but it's important to show. I think how every person recovers. About the nose thing, you can feel like after a while you get boogers and stuff, and just like be really careful. Don't like for many Q-tips. I used like some sort of band-aid, and I just rolled it a little bit just to to open them up. Don't touch it too much because it's during the healing process, so you don't want to mess with that. I'll just see what else. Yeah, I got a visit from my surgeons twice. Really professional people. I'm amazed at how they handled everything. So I'll see them on Tuesday, and I'll get some more x-rays and stuff. What else? Just fasts. Yeah. I guess you get a prospect before, so you know everything that's coming your way. Really important now for my nose is not to blow my nose during 6 weeks until the fast and everything recovers. So new blood vessels will be created and stuff. And otherwise, you're supposed to go up and walk around. Don't walk too much when you're dizzy. Just be really careful so you don't fall anywhere. But otherwise, you should walk because that helps the body take care of the extra waste things that's supposed to get out of the system, and also to prevent blood clogs. Yeah, I think it's called like that. And also to get your stomach rolling, and that could be a down fart. And that's the only thing I'm a little bit worried about, because my stomach hasn't started to function yet, to say the nicest. So I have to find something or some kind of extra laxer thing so it doesn't get constipated. So try the natural way first. I love the natural way first, and then afterwards you can use some kind of medication so you get your stomach on the go too. Yeah, so this is everything I had today. 16 minutes again. I don't understand how I can make these long videos. I'm thankful that you're watching this, and I hope that you learn a little bit about my experience and what to think about. And as I said, you're free to ask anything. I guess I will show you my how I look from the side. Yeah, I'll try to shut my mouth. I don't think you can see that much. But yeah, I don't have an underbite anymore. So weird. So weird. And this is how I look from the side. Yeah, first time I have chubby cheeks, but I like it. I feel like a baby. So, once again, thank you for watching. I'm gonna go and watch some TV series or something. Don't worry, I'm not in pain. I'm actually really amazed how good it went, Take good care of your medication where you're supposed to take it, and don't take too much if you don't need it. Thanks for watching. I want to thank my best friend for probably watching and laughing because I look like a Swedish meatball. But soon you will see me in life, so it will be better. Thank you, and see you next time. I don't know when, but I'll post something. Take care. Bye.